Welcome back to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's example is an 8-year-old male castrated Yorkie with stranguria. This patient also has a history of urinary tract stones and is already on a preventive urinary diet. Once you have reviewed the radiograph using your systematic approach, then you're ready to watch this video. In this case, you would have likely suspected calculi just from the history that I provided, and you'd be looking to use radiographs to confirm. Now, of course, I would always suggest as a radiologist using more than one view, but sometimes as a starting point, you may only do one view to get a survey of the situation and confirm your suspicion. Of course, you are right. There are urinary cystic calculi in this case, and in fact, the only view I have for this case is this single lateral view, so we'll be focusing on that today. To start with, when we look at the urethra, we can see multiple rounded calculi of varying sizes all stacked up here within the penile urethra, extending up towards the ischial arch, and there are several in this portion of the urethra here, superimposed on the pelvis, just cranial to that ischial arch. You'll note that ideally we should have had this entire portion of the urethra here included in the study, so we're not exactly sure about the status in this area. The other area that's quite difficult to assess for urinary calculi in both male and female dogs is the portion of the urethra that passes through the pelvic canal. On both the lateral and the VD views, there's quite a lot of superimposition of bone in this region, so it can be quite difficult to tell. When we're looking for urinary calculi, we of course should never omit searching the urinary bladder. So we can see that the bladder is fairly distended. I don't see specific minerals superimposed on here, although we do have some superimposition of small intestine as well as the superimposition of the thigh, which is common here when we're looking in the caudal abdomen. Many of you may have noticed this sort of radiolucent feature that's contrasted by a radio-opaque margin. This is an inguinal skin fold. We can also see skin folds in the thorax, as you're probably aware. So once you're comfortable that you have urinary cystic calculi, and especially when you're dealing with a patient with a history of this and you're concerned that the dog is blocked, you of course will want to proceed with emergency catheter placement to ensure that the patient's urinary obstruction is relieved. But I would encourage you, and again, this is the radiologist speaking, take another moment to finish off with the radiograph. I'll show you what the rest of my findings are. So I did note that there's mineral within the kidneys, probably affecting both kidneys, both right and left. These are nephroliths, whereas the more linear mineral features like this one here, let me zoom in so we can see them better. The more linear features are often dystrophic mineralization within the pelvic recesses, whereas the centrally located mineral features that are more rounded are often more consistent with nephrolithiasis. Returning to look at the rest of the radiograph, I would conclude that there's a bit of hepatomegaly with rounding of hepatic margins. I often, as you may have noticed, comment on splenomegaly but attribute it to most likely sedation. I do think that there's reduced serosal detail here in the mid-abdomen, which could be partly because of organ crowding, because there is a bit of displacement from the urinary bladder distension. So let's not forget the skeletal structures. I'm going to start by looking at the vertebral column. We're going to come back to the thoracic vertebral column in a minute, but what I want you to notice is that the ribs are splayed, which means that this radiograph is not straight for this portion of the thorax. Tracing the vertebral column along here, you'll see we have some degenerative changes noted at the lumbar vertebral column. So we've got, I'll just get these arrows out of the way. We've got some narrowing of the disc here, and you can see that the end plates are a little bit sclerotic. For me, those are findings that are chronic. The remainder of the vertebral column is fairly unremarkable. When we were looking at the pelvis, some of you may have noticed a little bit of an unusual appearance. I want to show you my approach to this case would be to trace. I like to trace when I'm looking at orthopedic structures, and I start with the part of the bone that I recognize, and then I take myself into the part that I'm not sure about. So if I'm tracing the ventral aspect of this part of the bone, I recognize this as ilium. And as I come across the ilium, I come to this beautiful rounded socket. This is a hip socket. However, it's empty. So the acetabulum here, we can see its rim, and I know that this is acetabulum by its shape and its position and its well-defined margin, but there should be a femoral head in here. And instead, both femoral heads are up here superimposed. So in addition to our urinary cystic calculi, which we snapped this radiograph to confirm, we can also say that we have a hip luxation. I think it's probably This hip that's luxated, which is the right, but it is a little bit hard to tell. I'm calling this the right hip because I know that this is a right lateral view. I cropped the marker off of this so you wouldn't have known that. But this is a right lateral view, so if the right femur is closer to the table, it's going to be less magnified than the left femur here. So to conclude, we have clearly urethral calculi. We were able to ascertain that from our one view. Stone removal may need additional imaging. Often this would involve hydroretropulsion. If you're doing hydroretropulsion, you definitely want to make radiographs to make sure, or even a urethrogram to make sure that the urethra is clear before you finish the procedure. Correlation with urinalysis, of course, and stone analysis to plan treatment. And the hip luxation should be further addressed with orthopedic exam and ideally, of course, the orthogonal view. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.